is. And we're recording chapter 15. And I'm gonna share my screen. And let's get even more depressed together, shall we? Some of you are like, psh, most of you, I should say, are like, whatever, this has nothing to do with me. All right, so physical and cognitive development, we'll call it development, although technically it is a change, so I guess it's a development. Be a, you know, resignation. All right. Middle adulthood, the ages 40 to 65, involves narrowing life options. Yay. Career paths that become more determined. We see progressive declines and sustained performance and other compensating gains. We see a shift in mindset from the time since I was born to the time until I die. We also see a revised physical self image. Our vision changes in middle adulthood. Presbyopia, around the age of 60, we have the inability to adjust our focus to varying distances. Our pupils shrink, the lens yellows, we see vitreous and neural changes occur, and our blood supply decreases. We have poor vision in dim light, and yet we have an increased sensitivity to glare. We have a decline in color discrimination, and our retinal sensitivity decreases. We have hearing changes in middle adulthood. Presbycusis between the ages of 45 and 64. That's age related hearing loss. The initial decline in sensitivity to the high frequencies gradually extends to all frequencies, and speech begins to be more difficult to make out. Men show earlier and more rapid decline. Hearing aids and are used other modifications to listening to the environment, and also communication changes can help. Skin changes in middle adulthood, wrinkles starting in the early 30s in our forehead. In our 40s, crow's feet at the edges of our eyes. Our face sags, our arms sag, our legs sag, our skin dries. We develop age spots after the age of 50. Our blood vessels become more visible, become like see-through, like some sort of lizards. And all this happens faster the more we are exposed to sun and being a woman. Our muscle fat makeup in middle adulthood, increase in body fat and loss of muscle and bone. The middle age spread is common. That's fat in the torso. Men is in the upper abdomen and in the back, women in the waist and upper arms. Our muscle mass declines gradually. Of course, this can be offset by exercise, especially resistance training. Now, the anti aging effects of dietary calorie restriction, the health benefits for humans. It can reduce the risk of age related diseases. For example, reduced cardiovascular disease, lower blood glucose, lower cholesterol, lower blood pressure. Our physiological response to food scarcity is evolved to enhance our body's capacity to survive adversity. The life extending effects for primates remain uncertain, but we know that longevity and reduced age related diseases as a result of calorie restrictions is seen in animals like mice. Skeletal changes in middle adulthood. Our bones broaden but become more porous. We see a loss in bone density. Women are at greater risk. We see a decline in the protective roles of estrogen and testosterone. Our bones become weak. Our discs collapse. Our height shrinks. Our bones fracture more easily. And when they do, it takes longer to heal. But a healthy lifestyle and exercise can slow bone loss. The climacteric and menopausal phases. This is climacteric references the gradual end of fertility. It's a 10-year process that ends with menopause. This ranges from the late 30s to the late 50s, but on average, the early 50s. It happens earlier in women who have not had children and women who smoke. We see a drop in estrogen. The monthly cycles shorten and eventually stop. We see increased complaints about sexual functioning, decreased skin elasticity, and a loss of bone mass. Yay. Menopausal symptoms, hot flashes, night sweats, difficulties with intercourse, moodiness, irritability, reported sleep difficulties, though they are not directly linked to menopause. Having those hot flashes are going to be linked to poorer sleep. Depression is associated with this phase, but this declines after menopause is over. Asian women report fewer complaints. So when they asked women 4 years before menopause, how depressed are you? Then during menopause, and then 4 years following menopause, those who have a history of depression have a much higher likelihood of experiencing severe depressive symptoms. But if you don't have a history of depression, significantly less. But you can see in all cases, once menopause is over, it drops back to probably a baseline. Hormone therapy for menopause. The benefits of hormone therapy: it will reduce hot flashes and vaginal dryness. There is some protection against bone loss. Now, hormone therapy options could be estrogen or hormone replacement therapies. This is associated with come on, words. You can do it. This is associated with many negative health consequences. So, some alternatives: a new estrogen based drug with fewer side effects, and even gabapentin is nearly as effective. What's gabapentin? Go on,
It's a
Uwe.
pain med.
It's an
Yeah.
anti-convulsion med as well.
Hmm. So essentially, it's mimicking GABA, right? GABA is an inhibitory neurotransmitter. But yeah, it is an analgesic. Now, our reactions to menopause, we see individual differences in the importance of loss of childbearing capacity, individual differences in physical symptoms, or even the expectations of symptoms. Many women find it little or no trouble. Baby boomers seem to be more accepting than other generations. It's also affected by our cultural beliefs and practices. For example, African American women hold favorable views. Menopause is a biocultural event because we are a Western civilized, industrialized, whatever you want to call us, culture. We're more babies. We look at menopause as a syndrome. It's medicalized, just like a syndrome. We report more symptoms, more discomfort. Greek women report symptoms but choose to ignore it. Asian women, in Eastern civilized culture, Asian women attain peak respect and productivity. Menopause is not a significant marker of middle age in their culture, and they also report fewer symptoms. Mayan women give birth to many children, and they look forward to it, so they can no longer have babies and report no symptoms. Now, some reproductive changes in men. We see a decrease in sperm volume and the sperm's motility. That starts in the 20s, and just regular ejaculate volume after the age of 40. We see a gradual decline in testosterone, but sexual activity stimulates production. See, we've always associated testosterone levels with libido, but it's actually the reverse of that. Libido, or I should say, the sex acts themselves, leads to an increase in release of testosterone. Some men experience erection difficulties. Sometimes it takes longer for them to become erect, and it's more difficult to maintain an erection. So they have often these problems are linked to anxiety, depression, physical disorders, injury, and just a general loss of sexual interest. But we do have drugs now that increase the blood flow to the penis that offer temporary relief. Now, our health in midlife. 85% rate their health as excellent or good. More chronic diseases seen than in early adulthood. Some gender differences. Men suffer more fatal illnesses, but women suffer more non fatal limiting health problems. Research we have, though, is limited on women and ethnic minorities. Sexy time in middle adulthood. We see a slight drop in the frequency among married couples. The stability of our marriage helps with this. So what I'm saying is, if you want to know if people are having sexy time, you just got to know how satisfied are they with their relationship. They feed each other. The intensity of our response declines, slower arousal due to climacteric phase. It's still important and it's still enjoyable to most. Um, Also, we see at this age partner availability changes. There are fewer single men and more single women. Because of what we talked about last week, men are more likely to get remarried uh, than women are remarried. Also, men are dying, so they become a hot commodity. Finally, something to look forward to. Illness and disability in middle adulthood. Cancer and cardiovascular disease are the leading causes of death in the United States. Having or experiencing falls will result maybe in a bone fracture. That seems to double in occurrence. Economic disadvantage will strongly predict poor health and premature death. There's a close connection between our psychological and our physical well being. So when you look at men and women and the number of deaths per 100,000 every year, you'll see that men more than women die of cancer, significantly more men than women die of heart disease, and then still significantly for all these, but like over 2 times for heart disease, and then about 2 times for unintentional injury. Cancer in middle adulthood. This accounts for 1/3 of the US midlife deaths, more men than women, higher in low socioeconomic status populations. This results from cell mutations. Maybe it could be due to a non functioning tumor suppressor gene or non functioning stability genes. It's often curable. 60% of those diagnosed survive 5 years or more, and survival also brings emotional challenges. So, if you look at the different types of cancer by prevalence, you'll see on the left men, the most common is prostate, then lung, then colon and rectum, then urinary bladder, then melanoma of the skin, kidney and renal pelvis, non Hodgkin's lymphoma, oral cavity and pharynx, leukemia, pancreas, and then all the rest, 18%. For women, the most common is breast, then lung, then colon and rectum. Same percentages, same rates, same prevalence between men and women. The only thing that switches is prostate to breast. Then it begins to switch a little bit more, a little shifting, but switching because men don't have a uterus. So uterus or uterine cancer, then thyroid, then melanoma of the skin, which is going to be 1, 2, 3, 4, 5, 6. For men, it's number 5. Then non-Hodgkin's lymphoma, same. Then kidney and renal pelvis, and that would be whatever that is, 8, and that was, I don't know, 6 for men. Then ovary, then pancreas, then all other sites. So, how do we reduce cancer risks? Know the 7 warning signs. That's next slide. Get regular checkups and screenings. Try to have a healthy diet. Try to get some physical activity. Try to avoid tobacco, excessive sun exposure, unnecessary x rays, industrial chemical exposure, pollutant exposure. Limit your alcohol intake. And then weigh the risks of hormone therapy. Yes. The 7 warning signs spell caution if you experience, not you, but if someone experiences change in bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast or elsewhere, indigestion or difficult in swallowing, obvious changes in warts or moles, and a nagging cough or hoarseness. Cardiovascular disease. This is responsible for 25% of middle aged deaths. These are the silent killers, right? We see high blood pressure, high cholesterol, not the good kind either, atherosclerosis. The symptoms are going to be a heart attack as a result of blockage, arrhythmia, which is an irregular heartbeat, angina pectoris, which is chest pain. How do we reduce our heart attack risk? With smoking, reduce our cholesterol, treat high blood pressure, maintain an ideal weight, exercise regularly, occasional wine or beer, occasional, take low dose aspirin, reduce hostility and stress. Say what? We'll get to that in a second. Osteoporosis, severe bone loss. We got tender little fragile bones now. The causes normal aging. With age, our bones, as we know, become more porous, so we lose bone mass. Menopause, estrogen drops. That will speed the loss. Sometimes it's due to heredity, your body type. Sometimes it's due to your lifestyle, your diet, your physical activity. Again, the smoking and the drinking. Women develop osteoporosis earlier, but men are often overlooked. So it's hard to say if it's really earlier. It probably is because of the estrogen drop. Preventing and treating osteoporosis. Let's take in some vitamin Dizzle, some calcium. Avoid excess sodium and caffeine. Mm-hmm. Weight bearing exercise, resistance training, bone strengthening medications, and early prevention. So don't wait until you're having problems. Do it before you have problems. Now here's the hostility in health. A type A personality. These are people who are competitive, impatient, easy to anger, and hostile. 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 This is associated with an increased risk of heart disease. Not type A, but hostility, which people who are type A are more, they exhibit more hostility. So expressed hostility, these angry outbursts, rudeness, criticism, contempt, this actually is correlated with heart disease and other health problems. In one study, they found looking at medical students, male medical students, they rated their hostility. They looked at and then they found them 25 years later, and those who had the highest hostility had the highest cardiovascular disease. Suppressed hostility and anger is also linked to high blood pressure and heart disease. So in the study that I was just talking about, you see it's not just a straight line of, less is better and then, more is worse. It's not just that. There's actually this dip. It goes like, if you have like low hostility, you have like this level of heart disease, and then it goes down, and then it goes up like this. So expressing some hostility is a good thing. You cannot suppress it, but you can't be overwhelmed with it. Everything in moderation. So we have to be able to manage our stress. We have to reevaluate the situation. Hey, maybe this isn't as bad as I'm making it out to be. Maybe I'm overreacting. Focus on things that you can control. View life as fluid, not this one straight line that I must do this, this, that, and the other thing. Consider alternatives. Set reasonable goals. Exercise regularly. Again, there's exercise. Use relaxation techniques. You can constructively reduce your anger, right? How? Maybe you show yourself as more assertive and not hostile. Maybe seeking social support. So we have these different coping styles when we are dealing with stress. Some of us are problem centered. Some of us go right to the root of it. So I got a problem with my colleague, my coworker. I'm going to go out to my coworker and say, hey, knock it off. We'll punch you in the chicklets. No, don't do that. That's hostile. We don't want that. Just say, hey, what's your deal, bro? What do you got against me anyway? What I did, you know? So you're going directly to the root of it. Emotion focused coping or emotion centered coping. Now what you're going to do is you're going to go, you know what? She's got a beef with me. That's fine. I'm just gonna stay away from her. I'm not even going to let it get the best of me. It's not even, no, I'm just not gonna let it do it. And then the last one is to go between the two to reduce stress. Go to the way we respond to it, emotion focused coping, and say it's not gonna get the better of me, or go to the problem and go, all right, we need to knock this off. Stress management in midlife. We have an improved ability finally, some good news. We have an improved ability compared with younger adults to cope more effectively. Hear that, Jake the Snake? We're more realistic. I don't know why. I can see you on my screen. We're more realistic about the ability to change our situation. We're
I
more
mean,
skilled. What?
it's definitely true. I have a very bad coping mechanisms.
Oh no, I wasn't even implying that. Honestly, I wasn't. I just know that you're significantly younger than I am. We are more skilled at, maybe I should change this. I'm able to more effectively cope than Jake. No, I am more realistic about the ability to change my situations. I am more skilled at anticipating and managing stressful events. So, of course, community social supports are helpful, but they're not as available as when we are in our younger, you know, young adult and adolescent, because we're always around our friends when we're young adults and adolescents. So when you reach middle adulthood, you don't want to be with anybody. You don't want to talk to nobody. You don't want to go out, and you just want to sit home and watch Matlock or something. Matlock. Oh, nobody even knows what that is. All right. Exercise in middle adulthood. Physical and psychological benefits. Yes. Right. You get the blood pumping, you're cleaning out the brain. Right. So we need to manage our stress. We need to, which will also reduce the disease risk. Only 18% engage in recommended activity levels. Uh, what are the problems? Right. There are barriers to beginning our exercise. Right. We go, okay, went to the doctor. Doctor says, I got some chunky buns. I need to exercise and it'll improve my mood. All right. So how do I start? Oh man, I can't start today. Right. I got a thing to do. I got I got work. I don't have any time. I'm tired. It hurts when I do it. I don't even have access to a place to walk or jog or ride a bike. But if we view ourselves as having high self efficacy, that will promote exercise. We still need interventions to reach the low socioeconomic status adults. Hardiness. Now, here's some good stuff. This is the ability to turn stressful situations into opportunities for resilience. These predict healthy behaviors and effective coping strategies. We have a sense of control. We regard most experiences as controllable. We have a sense of commitment. We find interest and meaning in daily activities. We have a sense of challenge. We see things as challenging, not threatening. We view as occasions for learning and self improvement. Okay, the silver lining in life's adversities. Okay, what this is about is this saying, hey, having some adversity in your life is protective, it's beneficial. Having little or too much, that's bad. Modest levels of exposure to adversity is linked to more favorable adjustment. It fosters mastery and a hardiness to overcome future stressors. Having no history of adversity, we respond less optimally because we lack experience. Having high levels of lifetime adversity, as in like frequent exposure to bad things happening to us, it can overtax our coping skills. We develop a sense of hopelessness, helplessness, loss of control, and it will interfere substantially with our mental health. So basically, here's our life satisfaction in red. If we have less, we're not very happy. If we have too high, we're not very happy. But if we got that nice, right? Modest, modest to moderate, you know? Average, okay, that's maybe a little too much. High, stop it. Low, no, because you're going to have stressors in your life. But if you can't effectively cope, you're not going to be satisfied. And the other ones are showing you, more stress is going to give you, again, here are the benefits. If you have a little bit, you have good function. You don't experience post-traumatic stress symptoms. You don't have much overall stress. So here, modest is good. These are the bad lines. So you want them low. This is the good lines. So you want it high. So when you have moderate, that's the best it's going to be right here. But then the more you got, now I have a lot of stress. Now I have a lot of functional impairment. Now I have a lot of post-traumatic symptoms. All the double standard of aging between the sexes. Despite women reporting they have hit their stride, aging men are rated more positively and women rated more negatively in both their appearance and their personality. There are societal forces such as in media, even cosmetic products exaggerate this view. We need to favorably portray older women as active, accomplished, and imaginative. Crystallized intelligence. This is intelligence that you've gained through your life. Okay. It's skills that depend on accumulated knowledge, your experience, good judgment, and a mastery of what social norms are. These are valued by a person's culture. For example, some examples of crystallized intelligence: vocabulary, verbal comprehension, general information, logical reasoning. This will peak in midlife, and then it begins to decline in the 80s. So our crystallized intelligence goes like this all the way until we get to late adulthood. Then it starts to drop. That's a positive. Fluid intelligence, this is our ability to solve new things. Like, all right, for example, right? You've seen this before. This is my phone, a flip phone. See? Now, when I watch my kids play, when I watch my kids play with their smartphones, they're like, and they're like, because they can type with two thumbs, and then I can't. I don't. You know what? Maybe I can. I don't want to. I don't want to. Part of me, I just don't want to appear like I'm having a midlife crisis, even though I really am on the inside. I don't really want to. So I'm like hanging on to the old school me, just to be like, no, I didn't need a flip phone then, which makes it sound older. I know it's weird. I can't win with myself. But
Man, what is with these people in flip phones?
why? Who else has a flip phone? I'm the only person I know.
One of our instructors has a flip phone. She told us, don't text me emojis because it'll crash my phone.
It doesn't crash my phone. It just shows up in squares. Actually, believe it or not, I'm not kidding you. I just got this one a week or two ago. I just got this one.
What
And the
happened
one
to
I
the
had
other one?
before it looked just like it, but a little bit smaller. And the one I had before that looked just like that one, but like bigger, like this one. And then I've had flip phones for the past. So when mine break, I get another flip phone. I actually
The new
spent money.
Samsung phones are touchscreen and they're flip phone. Did you see those?
Yes, I did. And you know how that would be even worse.
I feel like it breaks so easy.
Yeah, right. No, I don't know. The thing I don't like is I don't like the idea of having this big bulky thing in my pocket. You know, I don't know. Anyway, so our ability to solve new problems, it depends on basic information processing skills, uh, our ability to detect relationships among visual stimuli, the speed of our analyzing of information, our working memory, solving problems right now. We see a progressive fall off beginning in our mid 20s, and it doesn't get any better. So here's where you could see here's our ability to solve new problems. You know how they say like you can't teach an old dog new tricks? These are the new tricks right here. The ability to develop new tricks. No, no, no. Okay. So how do we explain changes in mental abilities? There's a general slowing of our central nervous system functioning. Our midlife declines in basic processing may not affect well practiced performance until late adulthood. So if it's something that, for example, if it's something that like I've been teaching this subject for 15, 16, whatever years. In theory, if you ask me a question, I should be able to answer it based on accumulated knowledge and applying, what I know right now at this moment. I should be able to do whatever because it's my area of expertise. We begin to also shift to activities as we age that depend less on cognitive efficiency and more on accumulated knowledge. That's what teaching is. All right. Well, but we're supposed to keep up to date on material. Factors predicting maintenance of high mental ability scores, our lifestyle. If we have high education, if we have a complex job, or leisure, if we pursue leisure activities, if we have a lasting marriage, if we have a high socioeconomic status, and then some personal factors, like if our personality type is somewhat flexible, if we like to use intellectual skills, if we are healthy and absent of chronic illness. Baby boomers have, some their generation has some factors that are resilient to fluid intelligence loss. And then lastly, perceptual speed. How quickly can we perceive things? Executive function in middle adulthood, we see declines in working memory, our ability to solve problems in the now. Spatial suffers more than verbal. Um, we have flexible shifting of attention that's more challenging to us. It's that sustaining two tasks simultaneously and switching between mental operations that becomes more difficult for us. Our memory strategies in middle adulthood, Our ability to recall studied information declines. We have reduced use of memory strategies. It's harder to retrieve information from long-term memory, and we have more difficulty keeping attention on relevant information. We do see some changes in creativity. We have more deliberate and thoughtful creativity. It's less spontaneous. It's intensely emotional, or less intensely emotional. We sum up or integrate ideas based on our knowledge and experience. We're less focused on new discoveries, and our goals become more altruistic. We're less concerned with, oh, I want people to, see how I express my whatever. They're more concerned about others. Our information processing. Middle-aged adults perform as well or better with experience-based knowledge and skills. Problems involving individual expertise, and tasks and test items that are relevant to real life endeavors. So we do maintain our ability to process information if it's relevant to our experiences, our expertise, and things that are related to real life uh, situations. Now, our jobs, right? Our vocational life and cognitive development. The work environment is vital for learning and maintaining skills. Complex work with challenging and new tasks will predict cognitive flexibility. It reduces decline in fluid abilities, and it will help sustain the cognitive gains that we make well into retirement. Here's a good one: becoming a student in midlife. 40% of US college students are over the age of 25. Nearly 60% of them are women. The reasons are diverse. They're looking to change jobs. They're looking to get better paid, maybe as in a promotion. Maybe there's a life transition where they went from married to divorced, or married to single, or married to widowed, or and they needed to sustain themselves. There's personal achievement reasons, there's self-enrichment reasons. The concerns of adult learners, though, is their ability to handle academic work. Aging, gender, and ethnic stereotypes also exist. And then there's role overload, right? You're not just a student, you're also mom, you're also dad, you're also employee, you're also employer. So you have all of these social roles. Of course, sources of support we'll get from hopefully, our partner, our children, our family, extended family, our friends, maybe the educational institution, and hopefully the workplace. Maybe they're saying, all right, you need to take off for these days of the week and these hours, and that's great. Well, I even help pay for your college. And that's the end of that. Does anyone have any questions? I'm going to stop recording. 3, 2, 1.